We want to share an organ donation story with you, one that never happened. Last November, 26-year-old Liam D. died of cancer, and his dying wish was to donate his tissue. But his medical records showed his wish was denied because of his, quote, homosexual status. D was considered a high-risk donor because he'd had sex with another man in the last 5 years. Now his family is calling that process discriminatory and is filing a complaint with the Canadian Human Rights Commission. Jacob McDonald is Liam's husband and is fighting for change to organ donor screening. Jacob, thank you so much for joining us.
Thank you for having me.
Let's start by talking about Liam. Tell me a bit about him and his story.
Liam was a very ambitious person. He was a loving husband. He took up sewing and he was a gardener. He could do pretty much anything he set his mind to. And he was a great nurse as well.
He set his mind to donating tissue when he found out he was sick. Why was that so important to Liam?
Liam had always been an advocate for organ and tissue donation as well as blood donation. And, it was something that him and I had discussed on multiple occasions for both of us, that would be our wishes. And that was just amplified when he got his diagnosis. That those were his wishes for them to use whatever they'd be able to use. He said that quite often.
So he made it clear what he wanted to do. Was it ever made clear to him that he was not eligible to donate?
It wasn't made clear to him or us at all that there might be an issue. He did have terminal cancer, and so we were understanding of the fact that they might not be able to take everything.
Mm-hmm.
A lot of those organs would probably be wrote off, of course. But like I said, he was always under the impression that they'd be able to use some of his tissues, and that's what they told us as well. And they led us to believe that there could have been things that would have been used. Now, it wasn't his diagnosis that was the reason for deferral, though. On the paperwork, it says that the reason for deferral had nothing to do with his disease. It was because of his sexuality.
Okay, so it wasn't because he had terminal cancer, and you can understand the implications of that. It was because he was gay. What was your reaction when you found out that Liam wouldn't be able to donate tissue?
It was quite shocking, especially when you read it on the paperwork. It says sex high risk, high risk behavior, patient had husband, high likelihood of sex with another male in the past 5 years. And so to read that was the sole deferral reason on the documentation. That was, I describe it as kind of a cherry on top of, what was kind of a really crappy situation to begin with. I had lost my grandfather the day before Liam had passed. And so I think shock had really set in at that point. And so for them to tell us that was just really the cherry on top. It was, just another, I can't even describe it.
We've seen similar stories about blood donations, for example, and the blood ban that's been a controversy for years. You're launching a complaint now with the Canadian Human Rights Commission. I wonder what changes are you hoping to see come out of all of this?
We're looking to see change we want policies to reflect more so social behaviors rather than just someone's sexual orientation. I take a lot of offense to the fact that they describe my sexual orientation in general as high risk behavior, because Liam and I were in an entirely monogamous relationship for over 4 years. And so I want to see change in policy that reflects people's actual behavior. Mm-hmm. And we were consulted when Liam was denied. They didn't know what his behavior was or what high risk things he was doing. They had no idea. They just found out that he had a husband and they completely ruled him out. And so I want to call upon Justin Trudeau to make that change and to, it's just outdated policy and it needs to be rectified.
So So this is the issue. It's not that there was a question or an assessment of Liam's sex life, your sex life. It was just an assumption based on your sexual orientation that they just decided you were automatically high risk and therefore disqualified. And that was done in no consultation with you, no conversation with you, and no verification with you or Liam. Is that correct, as I understand it?
That is entirely correct. The only person that they consulted with was the hospice nurse, and she was lovely. She was quite shocked as well when she heard the news on the other end that this was the reason for deferral. She just kind of mentioned it. This is what she told us, that she kind of mentioned it in passing, that Liam had a husband, and as soon as they caught wind of that, that was the end of the discussion, and they didn't go anywhere further. And that's what it says on their paperwork as well. Was the entire reason for deferral. There's no explanation for it, and it's because they don't have one. It's outdated policy, and it needs to be rectified. The policies are based off of old science. We're at a point now where we can detect HIV with a nucleic acid test, and we can detect it within 5 years, or sorry, within under a month. But the deferral period in Nova Scotia that's been quoted to us is that 5 years of abstinence is what they need to be able to be a tissue donor. And so, to me, it's just based off of old science, and it needs to be rectified.
So
These policies.
you've taken up this fight. If you get the change you're looking for, what would it mean for you to be able to honor Liam's legacy?
Nova Scotia Health kind of took that opportunity away from Liam to be able to leave his legacy and really help someone else in need. And that's a point I'd like to make too, is that, not only is this offensive to me, a queer person who also wants to donate my organs when I pass, but it's also offensive to someone who's waiting for organs and tissues that they need. And, I don't know why we're um, rejecting otherwise healthy young people just on a broad basis of just their sexuality is unconscionable to me. I think that these changes need to reflect social behavior. And I want that to be Liam's lasting legacy, is that we can see change in policy. And again, I'd like to call on Justin Trudeau to make those changes and make a commitment to rectifying this situation, because it's an injustice and it's discrimination. It's blatant.
Well, Jacob McDonald, I want to tell you how sorry we are for your loss, and thank you so much for telling us your story today. Thank you.
I appreciate the opportunity to get to tell the story, and I hope it resonates with people.